Welcome to this topic again, biology form 4. This topic is infectious and non-infectious diseases. So all of us here on the world, wherever you go, even yourself, you have ever suffered from a given disease. So now here we have two terms. We have infectious and non-infectious diseases. So now this topic is the very final topic in the syllabus of Form 4. So now here we have two terms here. We have infectious and non-infectious diseases. So now when we talk of infectious, these diseases that can spread to one person to another, from one person, the patient, to a person who is healthy. So now we have also what we call the non-infectious diseases. So these diseases are diseases that cannot be passed from one person to another. What we mean is if one person is affected, that person cannot pass it to another person. So these are what we call non-infectious diseases. And a good example of them is HIV/AIDS. HIV/AIDS is said to be, HIV/AIDS is one of the examples of infectious diseases. But non-infectious diseases, we talk of cancer diseases. No matter whether you get in contact with those people, you cannot get it. So therefore, cancer should be under non-infectious diseases. So infectious, at times we call them the communicable diseases. So here we are, infectious and non-infectious diseases. We have already pointed out that infectious diseases are communicable diseases, meaning they can pass from an affected person to a normal person. So we have given some few examples to say some diseases are infectious, others are not. If you take coughing, cough and sneezing, coughing can spread from one person to another. If a patient is there and you are dwelling together in a room, you are likely to catch the disease. So we are saying now let us look at the terminologies that are associated with the diseases. For you to understand this topic, there are terms that are basically used in this particular topic. So you talk of a pathogen. So we have pathogens. So these are disease-causing microorganisms. So anything that is causing disease, they are disease-causing microorganisms. They are pathogens. Pathogens there, we are referring to bacteria, viruses, fungi, and what have you. Bacteria, all these are referred to as pathogens. We have the term again, which is virulence. So virulence is the extent. This one is the extent to which the pathogens cause damage. For microorganisms to be considered a pathogen, it must. So we have some conditionalities that will make all microorganisms to qualify to be called pathogens. So there are certain things. So when we talk of the virulence, we are referring to the extent to which the pathogens cause damage. So this is the degree to which the pathogen can cause damage to an organ, to a system, to any tissue in the body. So for a microorganism to be considered a pathogen, it must have fulfilled some of the conditions that will be given next as we go. So there are conditions that are there for a microorganism to be called a pathogen, and some of these are as follows. We have number one, gain entry into the host. So the first thing, for a microorganism to be called a pathogen, it must gain entry into a host. A host is an organism that is accommodating a microorganism or a pathogen rather. So therefore, if a bacteria is causing a disease in you, then you yourself, you are referred to as a host organism. 2, it has to colonize the tissue of the host. It has to attack, it has to settle in the tissues. To colonize is to find a tissue and settle there. So that's what it means. It has to colonize the tissue of the host. Condition number 2. Number 3, it has to resist the defense of the host tissue. What they mean there is that a host can have the immunity. So once the microorganism has defeated, maybe for example, if you are talking of a human being has got what we call the first line defense, which involves the skin. Generally, these are the barriers that their body has. You talk of the skin. The skin is penetrative and the microorganism cannot even get entry into the host. You know, an organism is called a pathogen once it has gained the entry into the blood circulatory system. It means the first line defense is defeated. So the first line defense, we have a number of things. We have tears in our eyes. These can wash the microorganisms that are found in tears. We have also a chemical what we call lysoenzyme that can kill the microorganisms that can cause what? Diseases. All these, they belong to the first line defense. So when the bacteria or the microorganism has battled successfully and has gained entry into the blood circulatory system, there we call it a pathogen. We have what we call incubation period. So when we are talking of incubation period, this is the time between infection and appearance of symptoms. So it's the time you are affected by the disease and the time the appearance, the symptoms will appear in the time of infection. So the time you are affected up to the time when the symptoms appear in that particular person, that's when now we call that one an incubation period. So we have latency, we have the term latency there. So this is the time between infection and the ability of disease to spread to another person. So now latency is the time of infection and the ability of that disease to spread to another person. When that disease has settled in that person and is able to pass to another person, we call that one latency. Diseases affect 2 areas. There are 2 main areas that are affected by any given disease, and these are: 1, we have physical areas. Number 2, we have emotional areas. Physical areas could be any part apart from the brain and the other areas. So emotional area, you can have diseases of the brain and other diseases that can affect the brain and other areas, the spinal cord. But generally, the physical areas could be the muscles, any part of the body. So those 2 things are areas that the disease affect. Major causes of diseases. There are several causes of the diseases. Number 1, we have external factors, those that are coming from outside. For example, we have infectious diseases. So most of the infectious diseases that pass from one person to another are caused by external factors. Meaning to say, these factors could be the microorganism now entering into the body. That's why we are saying they are from external environment. Number 2, we have internal dysfunctions. When we talk of internal dysfunctions, we are basically meaning the internal parts of the body are performing poorly. For example, autoimmune disease. Autoimmune diseases are diseases that comes about when the immunity of one of yourself has started attacking body tissues. We call it autoimmune disease. Types of diseases. So we are going to look at the types of diseases, and these are, we have what we call the pathogenic disease. So these result from microbial agents. Generally, these are diseases that are caused by microorganisms or the pathogens. So we have pathogenic diseases. Number two, we have deficiency diseases. So we are saying these are diseases that result from receiving insufficient specific nutrients or not receiving at all. Examples, you talk of goiter, beriberi, and rickets. When you are talking of deficiency diseases, these are the diseases that comes as a result of not taking in balanced diet. When you are lacking a particular food nutrients in the body, so then these results into such diseases, such goiter, beriberi, rickets. So if you, apart from this, we have also pelagia, we have pernicious anemia, all those are deficiency diseases. We have scurvy, all those. So here there are just very few examples. Night blindness, which is caused due to lack of vitamin A. So such as are just the few examples that we can mention. We have also hereditary diseases. Now, the hereditary diseases, these are diseases resulting from the influence of transferred genetic traits. So they are diseases that are passed on from parents to offspring. So generally, hereditary diseases are diseases that can pass from parents to the offspring. So it's through gene mutation whereby we can actually inherit these diseases. For example, if you talk of sickle cell anemia, this is a disorder, genetic disorder that can pass to the offspring. So that one belongs to a hereditary disease, an example of hereditary disease. We have physiological diseases. These are diseases that can affect body tissues. They can affect body tissues as well as the systems. Then we have also the progressive disease. Progressive disease. It is a disease whose typical nature cause is worsening of the disease until death. Serious disability or organ failure occurs. It may also refer to as chronic or degenerative disease. So when we talk of progressive disease, in summary, we are looking at a disease that when affected, it continue affecting you until one dies. So it continues showing up the symptoms until one dies. So one can suffer for a long period of time until to the time of death. So we call that disease is progressive disease, or at times we call it is degenerative disease, or at most of the times we like it to call it a chronic disease, a disease that a person suffers continuously until dies or until passes on. Classes of diseases. So diseases are classified into a number of ways. Number one, we have what we call communicable or infectious diseases. So we have infectious diseases as a class of disease that can spread from one person to another. We have those that are non-communicable. At the same time, they are non-infectious. Non-communicable diseases are diseases that can pass from one person to another, either through direct contact or indirectly. So we call that one non-communicable. The diseases, non-communicable diseases are diseases that cannot pass from one person to another, even if there is direct contact. One cannot get the disease. For example, if someone is having cancer, you greet someone, you have hands contact, you cannot get the disease. So we call that one non-communicable. But communicable diseases, they can spread from one person to another, either by direct contact or indirect. These belong to communicable or infectious diseases. Selected infectious diseases. So we have just some selected infectious diseases. So those diseases that can spread from one person to another through different means. We have pneumonia. So pneumonia is one of the examples of infectious diseases. We have pneumonia is caused by bacteria, pneumococcus bacteria. So pneumococcus is a bacteria that causes pneumonia. Effects and the area where it affects. This one proceeds from mouth down to lungs, so it affects the lungs there. So the effects is that the fluid collects in the alveoli, so that results to hardened what? Lungs. So we are saying no air in lungs, inhibiting gas exchange in the lungs. So inhibiting the gas exchange in lungs, we mean it is there to prevent or to stop gaseous exchange, since the fluids collects within the lungs. Symptoms of pneumonia. What are the symptoms? When we talk of symptoms, these are just the feeling that a patient has. A sign is something that you can see with your naked eyes. But when we talk of symptoms, we are referring to the pain that the patient is feeling. First symptom of pneumonia, sudden chills and high fever. Generally, person feels cold. Rapid, shallow breathing and sometimes wheezing. So can produce some sound when is affected by that because it has difficulties in breathing. Cough with yellow, greenish color or mucus with some blood is also a sign or a symptom of sign and symptom of pneumonia. It has chest pains. Let us look at the treatment and control. So treatment and control of pneumonia. Number one, a patient should consult a doctor for adequate treatment. So generally, if a person is sick, should go there, should visit the hospital and talk to the doctor, and then the doctor can prescribe some dosage for him. Good ventilation, meaning there should be good circulation in a room where a person is accommodated or is dwelling. Avoid overcrowding. In areas that are overcrowded must be avoided. The second example of infectious disease is tuberculosis, TB, abbreviated as TB, tuberculosis. Causes, this one is caused by bacteria Mycobacterium tuberculosis. This is the name of the bacteria, Mycobacterium tuberculosis. Mode of transmission, how is it transmitted from one person to another? We are saying this disease, tuberculosis, is transmitted through breathed air, by air breathed by the patient. If that air is contaminated by a mycobacterium bacteria, then generally a person will suffer from tuberculosis or TB. Drinking milk from a cow suffering from bovine tuberculosis. So if you have you are taking milk without pasteurizing or boiling the milk, then you may have the same. You may suffer from TB. Effects or areas affected. It may attack any part of the body, but usually it attacks the lungs. So basically, the tuberculosis, the mycobacterium bacteria, they will attack tissues in the lungs as organs. So other parts include, it can also affect the bones, blood. At the same time, it can also affect the intestines. Symptoms of tuberculosis, which is TB. Number one, TB of lungs start with dry cough. You have dry cough, you cough, no mucus is coming. Spitting of blood after cough. So you can start spitting blood after coughing. That one is a sign that you have TB, tuberculosis. There is fever. Sweating at night. However, sweating at night, it could be due to hotness, but generally, if you are sweating even during winter period, just go for checkup. Maybe you might be suffering from TB. So there is loss of weight, you become weightless. Progress to death if not treated. So generally, a person can die if TB is not treated in time. Treatment and control. How can we treat and control tuberculosis? Number one, consult a doctor for treatment. Number two, reduce risk of spread by avoiding overcrowding. Don't be found in overcrowded areas. So because at times you may catch the microbacterium bacteria. So you can carry out an immunization in children with a BCG vaccine. Now, this BCG vaccine is standing for this. B is standing for bacil, C is for Cameti, then G for Guerin. So this one is a vaccine which is used to control and treat tuberculosis. Avoid taking raw milk, which means raw milk is the milk that is not boiled, but rather you have to boil raw milk or drink pasteurized milk. Pasteurizing, it means you are boiling the milk until all the microorganisms die there. That they have the potential of causing the disease. Another infectious disease that we have to look at, a very important disease, we have cholera. Cholera is a disease that claims a lot of lives in electoral areas in Africa as a whole. So in Malawi, because sanitation is a problem, generally this disease is associated in areas where there is a problem of sanitation. So now let us look at cholera. Cholera is also one of the disease caused by bacteria. Generally, it's a bacterial disease. So what specific name of this bacteria? Let us see now that one. Cause, we are saying it's caused by a bacteria known Vibrio cholerae. So there is an E there in front, which lives in water for a long time until it finds a host. So it is very common, that is to say it's very abundant in places of poor sanitation, as I pointed out. So the main cause of this is a bacteria, but however, it can be common in areas where there is poor sanitation, poor disposal of fecal materials, feces, which contaminate water resources. Mode of transmission. Mode of transmission, we are looking at how is it spread from one person to another, by what means, by what medium. So cholera is spread through drinking untreated water contaminated by human waste. If these human wastes are having the Vibrio cholerae, the bacteria, then one is going to catch cholera. At times, it can also spread through contaminated foodstuffs. Houseflies transmit bacteria from fecal material to food, uncooked, raw fruits, and vegetables. We have effects and areas. The area that is affected, it undergoes a 6-day incubation period. Remember, incubation period is time of infection up to the time of the appearance of symptoms and signs. Multiply rapidly in the small intestine. So the area affected, it affects the small intestines and produce highly poisonous or toxic substances. So the bacteria survive in areas of low oxygen concentration. So the Vibrio cholerae bacteria can respire anaerobically because it is surviving in the areas of low concentration of oxygen, which means it is respiring anaerobically. Generally, it's just breaking down food nutrients to release energy for its consumption. So that's what it means there. So remember, we have aerobe, anaerobes. So it's an anaerobe by nature. This bacteria is an anaerobe by nature. So these toxins are responsible for severe symptoms of cholera, severe vomiting. We have also abdominal pains. A person who is affected with cholera feels abdominal pains. There is acute thirst. Acute thirst. Now, symptoms of cholera: severe diarrhea. We have severe vomiting. There is also abdominal pains. A patient feels abdominal pains. There is acute thirst. There is also acute muscle cramp due to loss of body salts, because the salts are lost together when one is vomiting. So there is muscle cramp, meaning the contraction of muscles becomes a problem. Severe cases lead to death. Prevention and control. How can we prevent and control cholera? One, isolating infected patients. We can isolate all of the infected patients, meaning they must be excluded. They have to be removed in areas where they are overcrowded. So they have to be living in their own rooms. Vaccinations given to those under threat of possible infections. So vaccinations should also be given to those who are under threat. Construction of proper toilets, pit latrines, especially in crowded areas. If the toilets are constructed, for example, at the markets that we have, generally people, as they are selling their products, they can go there and help themselves by depositing feces into toilets. So that one will maximize sanitation and therefore prevent cholera. Discouraging open disposal of feces, meaning avoid defecating anywhere. Some people have that behavior of defecating along river banks. So when it comes to when those feces are contaminated with the bacteria, then the water will come and the rains will come and wash the water into rivers, where people will use this very same water for drinking. So that one can be a problem. Treatment. How can you treat? Treatment now is when you are affected with the disease. Now you want to find a remedy, a medical remedy. Treatment of cholera aims at replacing fluids. You remember, you replace the fluids because you lost a lot of fluids through vomiting, so you must replace. And maintaining the balance of mineral ions in the body. So this is done through giving oral rehydration salts or saline drips together with the suitable antibodies administered by qualified medical personnel or practitioner. The second example of infectious disease is what? Typhoid fever. This one is caused by Salmonella typhi. That's the name of the bacteria, Salmonella typhi. Effects and areas. What are the effects of typhoid and what areas does typhoid affect? So he is saying it has an incubation period of 2 weeks, that's 14 days. The bacteria causes typhoid is adapted to survive in areas of rocks in concentration. For example, it affects the small intestines as well. It can dwell in the small intestines as the Vibrio cholerae does. It is also an anaerobe. So the bacteria, the Salmonella typhi is also one of the examples of the anaerobes. It can also respire anaerobically to generate its energy. Mode of transmission, how is it spread from one person to another? Unhygienic handling of food and food products. So when you are handling the food and maybe you are already affected with the Salmonella typhi, then you can transmit. If a person will come and eat that food, is likely to get the disease. Flies feeding on infected excreta and deposit on human food. At times, the flies can land on uncovered food. If the flies have carried the Salmonella typhi, a person can catch typhoid fever. So flies are just vectors. These are just vectors, the carriers of the pathogens or the organism that cause diseases. What are the symptoms of typhoid? 1. Causes fever, headaches, abdominal pain, and diarrhea. Causes ulcers. Ulcers can also be caused by typhoid. In extreme cases, it causes the breakdown of the intestinal walls. So there is breakdown of intestinal walls. Prevention and control. How can we prevent and control typhoid fever? 1. Practicing isolation of patients. Patients must be allocated in their own rooms. Sterilizing clothes used by the patients. So the clothes that are used by the patients should be sterilized so that the bacteria cannot spread to other parts. Food handlers for institutions should go for checkups regularly. So those who are handling food, like the chefs, they should be going to hospital regularly to make sure that they are not affected by the same disease. Proper disposal of feces can also help. Thorough water treatment, that one can be done through water chlorination. Proper sewage treatment. Other one is good hygiene, like washing hands. We have to wash hands. You have to wash hands wherever you are before you handle any food. Disease caused by virus. So we have diseases that are caused by viruses. So we have looked at some of the bacterial diseases. We have looked at TB, we have looked at cholera, we have looked at typhoid fever, and we have also looked at pneumonia. So those diseases are basically caused by bacteria. They are bacterial disease. So most of the bacterial diseases are serious. They are serious, but they have a cure. They have cure. So let us also look at diseases that are caused by virus. So we have a wide range of viral diseases. So those people who study virology, is the study of different behaviors of viruses that exist on Earth. So most of the viral diseases are also pandemic in nature, because this time we are also talking of coronavirus, which has scared the whole world. So it has attracted a lot of attention, from different government stakeholders. So in this case, viral diseases are very, very dangerous, and most of them, some are cured, but some are not. So they are very unique indeed. The first one is common cold. The first viral disease is common cold. This common cold is caused by virus. Common cold is caused by virus. In our local language, in Chichewa, we call it chimfine. So this one mode of transmission, how is it spread from one person to another? So we are saying it is transmitted through droplet infection. Droplet infection. Symptoms of common cold: running nose. There is some mucus running through your cheeks. Sneezing. There is fever. Now, control and treatment. taking prophylactic drugs, being in a well-ventilated rooms. Make sure that you are living in a room that is well-ventilated, meaning to say there is good air circulation. Avoid overcrowded areas. The second one is influenza. Influenza is also a disease caused by a virus. So we are saying it is caused by influenza virus. Effects and areas. It has an incubation period of 7 days, that's 1 week. So the virus has neuroamidinase, which liquefies the protective mucus layer of the throat. So it can affect the throat, exposing its epithelium. So the hemagglutinin spikes attacks the exposed area. Mode of transmission, how is it spread? Spread through air, contaminated air. If the air is contaminated with the influenza virus, then if a normal person inhales that air, can catch the disease. It can spread through touch and contact. Spread through air, we have already said that, touch and contact. Symptoms of influenza virus: sneezing and sore throats. So there are sores that are found on the throat. Fever and chills, body aches, dizziness, headaches, lack of energy, nausea and vomiting. Control. How can we control and treat influenza? Control and treatment of influenza. So use of drugs that lower the fever. We have paracetamol, aspirin can be used to treat influenza, to relieve the symptoms. So aspirin can actually relieve the symptoms. Antibiotics used to prevent secondary infections. Use cough drops. Drinking hot drinks. Use of antiviral drugs in severe cases. The third disease, viral disease, is measles. Measles are caused by virus. So the virus can also cause the disease. So we have rubella virus. This causes Germany measles. The second one is rubella virus. This causes the ordinary or red measles. We have rubella virus. Effects and areas affected. It has an incubation period of 10 to 14 days. That's 2 weeks. Symptoms of measles: a patient feels fever, feels cough, general body weakness, reddened eyes. The eyes look very red. There is running nose, loss of appetite to food, rashes on face, which then spreads to the rest of the body. But these rashes, they are not itching, non-itching rashes. So the patient feels headaches, has swollen and soft lymph nodes. In pregnant women, painful joints and the disease can cause deformity of the unborn baby. Control and treatment: immunization of children under 5. So after recovery from a measles infection, survivors of the measles get natural active immunity. So remember, under immunity, natural active immunity is acquired when one has just recovered from an illness. So after the recovery from an illness, it's very difficult that a person can suffer again. So they can never be affected by the disease again. Another example of it, viral diseases or disease caused by viruses, we have chicken pox. Chicken pox. This one is caused by a virus known as varicella zoster. Effects and areas has an incubation period of 14 to 15 days after infection. Mode of transmission, how is it spread from one person to another? It's highly contagious through air droplets, contact with infected person. Symptoms, rashes on the skin, a lot of itching on the skin rashes, there's mild fever. How can we control now chicken pox? Control and treatment. This one is through immunization of children. After recovery from chicken pox infection, survivors of the measles get natural active immunity. They can never be affected by the disease again. So a person can also acquire natural